So today we're going to be spending our time in the front desk section of Amazing Charts PM. So here is where your front desk staff will be able to complete the majority of their tasks on a daily basis. You'll see the front desk is broken up into 4 different panes: front desk activities, patient search, manage appointments, and outstanding recall summary. Anything that you see highlighted in blue in ACPM and possibly underlined is a link. So all of these links under the headers will bring you to different areas of ACPM. So make appointments will bring you to the appointment scheduler, which we'll be going over a little bit later. Enter new patients will bring you to the new registration screen, which we'll also be covering momentarily. Enter transactions, you'll access our charge entry screen and the payment entry screen. So we do provide a few billing links under the front desk section of Amazing Charts PM, because depending on the size of your practice and who's responsible for what, your front desk staff may need to access these links from time to time. Managed care is where you can manage referrals and prior authorizations. And under the miscellaneous section, there are additional options, but typically front desk will use the daily appointment list more often than all of the other options under this section to print out a daily appointment list that they can work off of in addition to the actual appointment book screen. And we'll go over how you can run that daily appointment list also a little bit later. The patient search is just that. It's where you can search and pull up a patient chart in ACPM. From here, you'll see there are 2 fields, search for and the by field. The search for is where you'll put in your criteria for searching for your patient. Most people search for patients either by last name and first name or date of birth. So if I'm going to search for a patient by name, the best way to do it in Amazing Charts PM is last name first, comma, space, and then first name. And then depending on whether you're a keyboard person or you like your mouse, you can either click on search over on the right or hit enter on your keyboard. Then you'll notice once I hit search, it'll pull up all of the patients that match my criteria. So here is my patient. Here's their chart number in ACPM. In ACPM, chart numbers will always be indicated with the letter P. Date of birth, home phone, city, and state if that information had been previously entered for that patient. If you prefer to search by date of birth, if I put in a date of birth format, and it does want 8 numbers, and I hit search again, it's still going to pull up that patient for me. And you can search for patients in ACPM by any one of these criterias. So name, even their chart number if you knew it. Chart number is going to be their AC number. So they actually will have 2 different numbers. Their ACPM number, again, will be indicated with the letter P, and their chart number is their Amazing Charts number. You can search by social, date of birth, home phone, city, account number, or their responsible party number. I usually recommend leaving your by at auto because the system is intuitive enough that it knows what you are putting in this field over here in the left in order to search the database. But you could also specifically select the by field that you're searching for as well. Either option works. The Manage Appointments screen, this is an additional way to manage appointments for the day. You'll notice here that you have a couple of options to sort and filter your appointments. So if you have multiple resources in your practice, you could select from this drop down which resources you want to view their appointments for and or location. If you leave these fields blank, it's going to show all resources at all locations. It will always default to today's appointment date, but you could change this date if you wanted to look at another day's worth of appointments. And then down here, it will list your appointments by patient's name, last name first, the status of their appointment, the reason, so their appointment type, who they're seeing, at what location, time, and then under action, you can take different actions on each one of these patients. So for example, I could launch into Charlie Smith's chart from here. I could review the details of his appointment from here. I could do a manual eligibility check. We don't print encounter forms in ACPM, so you won't be using the encounter form link at this time. You could mark the patient either checked in, missed, which indicates they were a no-show, or that they were seen, which also means checked out. If an eligibility had been checked for the patient, whether it was an automated check done by the system or it was a manual check done by a staff member, the eligibility status would display under this column here. So this is a nice quick way for your staff to see the eligibility status check for patients for a given data service. So it would say eligible, ineligible, or in this case, inquiry cannot be created because I'm in a training environment and I can't actually check eligibility. I also provide in today's PowerPoint the multiple ways that you can check eligibility in ACPM and or view eligibility statuses in ACPM. And I also give you an example of what it will look like when you do view an eligibility status of eligible and the payer that was checked responded back with benefit details for that patient. So indicating, their co-payments, co-insurance, deductible information, whether referrals and authorizations are required, etc. So you can see what it will look like when the system checks eligibility. And then finally down here is the outstanding recall summary pane. So this is an optional feature in Amazing Charts PM that you may or may not decide to use. Recalls can be used to track upcoming appointments for patients, and it can be used one of two ways. You can either use it to reach out to patients that are coming in for specific appointments and they have the appointment currently booked in the system, or maybe you don't book out appointments that far in advance. So annuals, maybe you don't necessarily book them out a year, or certain tests like a mammogram or colonoscopies, you can set up a recall or reminder in a patient's chart. So once they fall into one of these time frames, they would get flagged under the outstanding recall summary screen under front desk. So a staff member will be able to come into the recall type and the current month or whatever the status, time status that they want to select. And then from here, they could generate the recall list using any of these search criterias up at the top here. And then once they get this list, they could either work off the list right on the screen, or you'll notice that there's a generate letters link. So they would actually be able to come in here and run a letter for these patients, or maybe just a simple list. And you'll see momentarily how you can add a recall to a patient's chart. If you do think recalls are something that you will utilize in your practice, you set up recall types under administration, appointment scheduling, recall reason table management. So you will need to come in here and add all the possible recall types for your practice. So going back up to patient search, I'm going to go ahead now and I am going to launch Jacob Doe's chart from here. So to launch his chart, I can simply just left click on his name highlighted in blue. And now you'll notice that the system navigated me away from the front desk, and it's now showing that I am in Jacob Doe's chart. So you'll always know what screen you're viewing in Amazing Charts PM, because over here in the View Navigator panel, it will always have the link highlighted for you. And what's nice about Amazing Charts PM is that you can be working in multiple screens at one time. So if I was in Jacob Doe's chart and the phone rang and I had to temporarily get out of it and go into another chart, I could go back to my front desk, go to patient search, or really go anywhere else in the system. So you'll now see I'm in Katie Phelan's chart. I could perform whatever task I needed to do, and then when I got out of Katie Phelan's chart, I could simply go right back into Jacob Doe's chart. It is recommended, though, once you are done working in a screen, that you go to the top right corner and you X out of it. Because if you don't, this View Navigator will get very congested as the day goes on. And if it reaches down to the bottom of the View Navigator, the system will automatically wipe out all of the information in the View Navigator. So rule of thumb is that you don't want to have too many screens open at one time. So here's what a typical patient's chart may look like in your practice. Obviously dependent on how often the patient is seen and how long they've been with your practice, some charts are going to be more robust than others. So my test patient, Jacob Doe, has a pretty robust chart for training purposes. So you'll see the first pane in his chart is the patient demographics pane. All of the panes will always have a general header at the top of it, indicating the type of information that is stored within that pane. So the patient demographics pane is going to store your common demographic information. So their name, their amazing charts, practice management chart number. You can also see that information up in the top left corner here. His address, phone numbers, date of birth, gender, primary care physician, if that was noted, and then if a general note had been entered on his demographics, the note. And then some of these panes have additional links at the bottom of them. The More link allows you to go in and view the entire demographic screen for this patient, and it will already be in an editable format for you in case you need to make revisions to it. So you'll now see I'm in the patient demographic screen. And let's say, for example, I wanted to now add a work phone number for him. I could do that from here. And then if I wanted to maybe add a note over here on the right, and once I update my information on any screen in Amazing Charts PM, I want to make sure that I save it. So you want to hit F2 or save down on the bottom right here. So now you can see the work phone number I added and the note. The add account link I'm going to skip for the time being. We'll revisit that in just a moment. The free care form, you have the option to edit or print. If I hit edit, it'll bring me to the free screening eligibility form that you could fill out for your practice if this is something that you would utilize. And then once you complete this form, you can save, and you could even print it. If you track referrals in your practice, you'll notice there's an add referral link. The add referral link will bring you to the manage referral screen where you'd be able to see any current or previous referrals that were on file for that patient. And it automatically brings up a new referral screen down at the bottom in case you wanted to enter a new referral. If you wanted to just put basic information in any of the screens in Amazing Charts PM, you will notice that certain fields highlight in a reddish pink color. And what that means is that that information is a minimum amount of information that has to be entered on that screen prior to saving it. It may not be all of the information that's required for billing, because, for example, you do need a referral number, but as far as Amazing Charts PM goes, to do an initial setup of a referral for a patient, you do have to put in at least this information. If you do track referrals, referrals get their own pane in the patient's chart, and it'll show you the referral number if one had been entered, the reason if it was linked to a case, the status of the referral, how many visits are remaining if a number had been allocated during the referral setup, and the effective date of the referral. You can also launch into the referral from the pane by clicking on the highlighted referral number. The same goes for prior auths. If I click on the Add Prior Auths, it would show me if there are any current authorizations on file for the patient. Otherwise, I could go in and add a new authorization. You also have the ability to set reminders. So if I wanted to be reminded maybe a month or two before the expiration date of my referral or prior auth, I could set a reminder date, and then on the back end, whoever's doing the billing would get a reminder flag that this referral or prior authorization is going to be expiring. Same goes for if you had a max number of visits. You could set when you wanted to be reminded for visits and even costs. And then you can track different statuses. So you could track when the authorization was requested versus when it was approved. When prior auths and referrals are completed, they'll go into a closed status, and you can void authorization and referrals if they were never used. And auths will also get their own pane in the patient's chart. Add treatment plan is not currently used in ACPM, so I'm going to skip over that one and go over to the patient notes. So notes can be tracked in different areas of the patient's chart. This patient notes will create a patient alert box, and you would then be able to see any and all notes that have been entered through the patient note link. You'll also notice that it will indicate the number of notes to the right of the link. And there'll also be a little notebook icon on the top right corner of the patient's pane for the demographics, indicating as well that there is a note. If I wanted to add a new note from here, I can click on Patient Notes. It'll show me any current notes, and then I could go ahead and hit Add on the bottom left. All of these note types are pulling from note types that were set up in the administration section of Amazing Charts PM. We do load some default notes, so we get you started with the different note types that you may want to track for your practice. But if you find that some of the note types that we've defaulted for you, you either would not use or you'd like to add more note types, you could go to Administration, Advanced Setup, Note Type Table Management, and you could either click on a note that you would not use and delete it, or you could hit Add and add some additional notes. It'll ask you to enter a code, which is really just an abbreviation of the note description. And then put in your description. Don't have to put an effective date. Usually that's if you're going to deactivate a note. And then it's up to you whether you want to also include some default note content in this note template. And it works just like Word. You can cut, copy, paste, bold, italicize, and even color code text and background color. You can also set up priorities and severity levels for notes. Depending on the priority and severity level you select would really just determine what order it displays in the patient alert box or wherever the note is going to be listed. If you have two notes that are in the same priority and severity level, they would just show in the order of which they were entered. You also have an additional option to set up notes to display on certain documents. So here, if this was the type of note that I wanted to put on my statements, I could check off the statement box. If it was a note that was required to populate in box 19 of the paper claim form, I could select paper claim. Or if I needed it to display in the equivalent of box 19 of the electronic claim form, I could select electronic claim. Otherwise, if it's just a general note, you can leave the appear on field blank and go ahead and hit save on the bottom right. Then I could go into my note table. I selected note type under the patient notes. Here's that content. I could always override it or add to it if I wanted to. And then I'm going to hit save and it will add my new note. It'll also time and date stamp along with the user that added the note. So here is an example of all of the different patient alert options when you add in a note. And I mentioned before that you could also just click on the little note icon on the top right corner of the demographics. And then recall. We talked about recalls at the beginning. So under front desk, outstanding recall summary is where you can manage the recalls. But when you want to add a recall for a patient, you're going to do it right within their chart under the Add Recall link. So here you'd also be able to see any existing recalls, and then it would already have you set up to add a new recall. And to add a new recall, you really only need to select the recall reason and the date for the recall. You could also add a recall note, but you don't need to. And recalls will also get their own pane, just like the prior auths, referrals, and alerts. And I'll show you later on how you link a recall to an appointment. And once it is linked to an appointment, it will stamp the appointment date here, and it will be in the status of scheduled. So that's the patient demographics pane. You'll also notice there's a little drop-down arrow. And this drop-down arrow allows you to access other areas of both the patient's chart and system quickly from here. So I could launch, again, the patient's demographic screen. Here's a quick way to get into the appointment book screen from the patient's chart. I could print an individual patient appointment list for this patient. I could print a demographic information sheet for this patient. I could manage this patient's accounts, and then we don't use these two options here. The next pane is the account pane. So this is where you're going to store the responsible party for the patient. It's where you will track insurance balances and patient balances, and it's also where you store the patient's insurance information. So you could have patients coming into your practice and they're being seen for just regular routine services. So they will have a medical account set up with all of that applicable information. But then if you see patients for other circumstances like workers' comp or motor vehicle cases, they could have additional accounts that are tied to the responsible party. You could track their insurance and or patient balances separately and also track the insurances for those circumstances separately. And then the account pertaining to the visit that that patient was seen for would get tied to the visit so that when billing is done out of the system, all of the applicable information goes out. So this is where you'd be able to see any accounts that have been set up for the patient. This add account link over here under the patient demographics would allow you to add an additional account if you needed to for the patient, and also see the existing accounts on file. If I wanted to manage this individual account, I could hit on more and it would allow me to go in and edit this account. But it also gives me flexibility to view and edit the other accounts as well. So you'll notice that with Amazing Charts PM that there is quite a bit of flexibility on how you view and work different areas of the system. Also under the accounts pane, there is a charge entry link, so you could enter manual charges for this account if and when necessary, and we go over the billing in session 3. Patient payment is where you could enter any patient payments. So if this patient was paying their copay for their appointment today, I could come into the patient payment entry screen, select the payment type, and once again, these payment types are pulling from payment types that were set up under the administration section of Amazing Charts PM. So if you do want to edit or add to the payment type options, you can go to Administration, Advanced Setup, Payment Type Table, and you'd be able to see all of the default payment types that we've loaded in for you. You could delete or add additional payment types. So you'd be able to select the payment type, enter the amount that the patient is paying. It will default to today as the payment date. It'll pull in the responsible party, ask you whether or not you want to generate a receipt for the patient. You could add in a payment note and then hit save on the bottom right. The system would then give you the opportunity to apply that payment to one or more of the patient's outstanding balances. So you'll see here, it shows you if the patient has an outstanding balance and asks if you want to apply it. And you could, if you wanted to, by entering in the amount to be applied in the apply field. Or if you want to just leave it in unapplied, which most front desk staff do, because they're collecting and entering payments before the service was actually rendered. So you could just leave the apply field blank, hit save, and the system will then go ahead and save the money in the patient's unapplied bucket. So when you hit cancel, it'll say, do you want to leave that payment as unapplied? And you can hit yes. Any money that's entered into the patient's chart and is stored in their unapplied bucket will show under the account next to the responsible party's name in this gold color. The ledger is where you can see financial transaction history for that patient's accounts. And you'll notice that there's some filters up at the top for you to sort through the ledger if you want to. And the ledger is covered in more detail in the billing sessions, but it's good to just point it out when we're reviewing the patient's chart. So if you did need to go in and view the patient's financial transactions, you know where to do that. And if you wanted to, you could even print out the list of the financial transactions based on the filters that you utilize on this screen. Account notes. So like the patient notes, you can track notes specific to the patient's accounts. Unlike the patient notes, it will not get its own pane, but instead it will show you how many notes are stored for that account. And you can either click on the account note link to review those notes or click on the notebook icon. So here is where I could see the notes, and I could also add additional notes. If I wanted to add an additional insurance to the account, I could hit Add Insurance. I could also demand a statement and or receipt for this patient's balances. You'll also notice there is a check eligibility link. So if I can check this patient's eligibility and I wanted to from here, I could click on the link. I could fill out the inquiry details of the eligibility and then select check eligibility down here on the bottom left, and the system would then initialize the check and then respond back with the status and details of that response. So each one of the additional accounts that are set up for the patient would have those links at the bottom there. You'll also notice that there's a drop-down arrow that would bring you to different areas of the patient's chart if you wanted to get to them that way. The visit history pane is where you can see the patient's previous dates of services. So you'd be able to see the visit number, the date, chief complaint if it came over or was indicated on the charge screen, the account that it's tied to, the case, the provider, the patient balance, insurance balance, and then you could take different action on the visits. And all of this is covered in more detail in session 3. So we talked about patient alerts. And then there's the upcoming appointments pane. So here is where you could see any upcoming appointments for this patient. Or you could even see any historical appointments for the patient. You'd be able to see the date of the appointment, the time, the status of that appointment, the reason for the appointment, who the patient saw, and you could easily launch the appointment screen from here or view the details of the patient's appointment. And another little tip and trick about Amazing Charts PM is that anywhere in the system where you see columns, you can change the sort option for that column. So if I wanted to reorder my appointment history pane to put all of this patient's historical appointments in order of status, I could double click on the status header and it will reorder them for me. And this is nice because if you wanted to quickly see all the times that a patient maybe missed their appointments, because maybe you have to send them a gentle worded letter, you could click on the status. Or maybe the reason. Maybe you needed to quickly see when their last physical was. I could sort it and put all of their physicals in order and see when their last physical was. You could also rearrange the columns. If you wanted the information to be in a different order. So that's just a couple tips and tricks about the different columns in ACPM. And then we went over referrals, authorizations, and recalls. So the last two panes are the claim history pane and the statement history pane. And again, we talk about these in more detail in the billing sessions, but the claim history is where you'd be able to see all of the dates of services that were actually billed out of ACPM. And you could see whether it was billed out electronically or paper, the plan associated with it, the visit number, date of service, the claim date, the status of the claim, and then you would be able to take action on any of these claims. And then as far as the statement history, if a statement had gone out for the patient, here's where you'd be able to see the statement date, statement amount, and you'd be able to click on view and actually bring up a copy of the statement if the patient called and had questions on it. And you could, look at the statement that the patient received, answer any questions that they might have about the statement, and maybe even possibly reprint it for them if they happen to be in the office. So that's a general overview of the patient's chart. Next, we're going to look at registering a new patient. So I'm going to go back to the front desk screen. So from the front desk screen, if I wanted to register a new patient, I can click on the patient registration link, but I also wanted to point out that there is a drop down immediately to the right of the front desk link that you could also use to launch different areas of ACPM. And one of them is that patient registration screen. You'll also notice that the additional options are the same links that are accessible from the front desk activities pane. So you're going to really decide, as an individual user, how you want to access the different areas of the product and what's going to be most convenient for your workflow. So I'm going to click on the patient registration link. And you'll see when you launch the patient registration screen that it's broken up into 5 different sections. We got the demographics up at the top, the financial account down here, and then the primary, secondary, and tertiary insurance. If you like to do mini registrations for new patients, you can do that in Amazing Charts PM. The only 3 fields that are required on the initial patient registration screen prior to saving the demographics are name, gender, and date of birth. And most of the fields are either free type fields or drop downs. So the name is a free type field. So I could either type in the patient's name, or if I click on the icon to the right, you'll notice it expands the field for me and allows me to format the information properly in each field. You'll also see that you can do company billing or employer billing if necessary. Same thing with address. It's a free type field, or if I click on the icon, it'll expand and I can properly enter the information in the correct format. And I'm not going to go through a total new registration because a lot of these fields are pretty self-explanatory, but I'm going to do some of the registration for you and point out some key pieces of it. So the county is where you'd be able to select the county if you track counties for your practice. And again, counties are added and managed under administration. Home phone number, so you could enter the phone number for the patient. home contact name, work phone, mobile phone, email address, emergency phone, emergency contact. The patient number will auto-populate and so will the chart number, gender, and date of birth. Employment status, student status, deceased and date of death would pull over from Amazing Charts if and when that's indicated. Social, if applicable. Marital status. Employer, so this would be the employer name and then the employer address. If you have multiple providers in your practice, you could select the provider that this patient's going to see. Primary care provider, if applicable. If you have multiple service locations, the service location this patient should be tied to. And also referring physician. Referral source indicates how the patient was referred to your practice. If it was referring physician, the system's going to expect you to select a referring physician. If you select other, you could select from other referral sources that you can set up in Amazing Charts PM. So if you do any kind of marketing campaigning for your practice, whether it be door-to-door, newspaper, pamphlet, newspaper, magazine, etc., you can add these and track them in Amazing Charts PM and even report on the different referral sources. And referral sources are also added in administration. Under table management, referral source table. Date of first contact will default to today's date. Language and ethnicity, if you track that for your patients. Note, so that would just be a general note that you want to indicate for the patient. Custom is just any additional information that you may want to store for the patient. And then expiration date is really only if you're going to deactivate the patient. The financial account is where you're going to set up those account types. So again, we do default some standard account types for all of our practices that we think you would use. But of course, you can add or edit these different account types if you would like to. Under administration, advanced setup, account type table. And just to show you a nice little shortcut that exists in ACPM, is that if you are in a certain field and there is a table equivalent for that field in administration, down here at the bottom of whatever screen that you're working on, it will say Manage Table. And if you are clicked in that field and click on Manage Table, it'll automatically bring you to that table in administration. So just a nice little shortcut. Then you would note the responsible party for that patient's account. So if you indicate self, it'll pull all of the self information you indicated up at the top. Or if the responsible party is also a patient of your practice and they're already registered as a patient, or maybe they're linked to another patient as a responsible party, when you select the responsible party type, you can come down here and click on this Connect to Responsible Party link, and the responsible party field would then actually turn into a search field. And you would actually then be able to search for that responsible party in your database. So here is all of my different responsible parties that exist. Then it'll automatically default an account number. Family and consolidated billing is if you do any Consolidated or family billing, basically that responsible party, if they were linked to multiple patients, would get only one statement for all patients that they're linked to. Billing status is another option that you have in ACPM if you wanted to track different billing statuses for your practice. Maybe if you hold statements for patients from time to time or for different collection statuses, you can set up billing statuses and then flag those status types on individual patient accounts, and then you can actually report on these different statuses. And if you want to do billing statuses, once again, those are set up under administration, advanced setup, table management, one more time, billing administration, billing status table. I was getting myself tripped up there. And you even have the option when you set up billing statuses whether you want to suppress statements for that type of status. And then if you do set up sliding fee scales for your practice, over by the default charge program field, you would be able to select the fee schedule or scale schedule for that patient. And then effective dates you would really just utilize if you needed to deactivate an account. And then here's the insurance setup. Pretty straightforward. You have the plan. So this is pulling from your plan table. And we covered this in session 1, that you want to make sure that for all plans you're going to be billing for out of ACPM, have a corresponding address in there for them. So you'd be able to come in here and either search or select from the plan list that the patient has. The policy type that is defaulted for that plan will automatically populate, or you could select a different policy type from this drop down. You can override it if necessary. The relationship to the subscriber, so who the policy holder of the insurance is. If it's self, it'll automatically populate all the information for you. The employer, so you can indicate the employer that holds the insurance. And then the insurance ID number that's on the patient's card. Group name and group number, if applicable. Card serial number you'll never use in ACPM. Here's those effective dates, and usually only use effective dates when you're deactivating an insurance. And then the release info, assignment author, and patient signature source is where you're going to indicate whether or not you have signed consent on file from that patient giving you permission to bill their insurance for their visits. And these 3 fields do need to be populated in order to bill a claim out of Amazing Charts PM for that patient. So you want to make sure for all patients that these 3 fields are filled out in ACPM. And I do indicate all of this in today's reference guide. Crossover coverage will always be blank for primary insurance setup. And then you could just indicate if they have a copay, coinsurance, and deductible responsibility for that insurance. And then there's a secondary and tertiary option if applicable. And the only difference is if the patient did happen to have Medicare, and Medicare does automatically cross over or piggyback to the secondary insurance, you would want to make sure when you set up the secondary insurance, if the patient has one after Medicare, that you do indicate whether or not it crosses over. And of course, in this case, it does if the patient had Medicare. So you would want to set up crossover coverage to yes. Because whenever the secondary insurance is set up as crossover coverage yes, the system will not produce a claim form for that secondary because the primary automatically sends it to the secondary. So that's really the only difference between the primary and the secondary insurance setup. And then once you complete the information, you can hit save on the bottom right, and it will bring you to the patient's newly created chart. And it will show you all the information that you've entered for that patient. So now I'm going to return to the front desk screen and we're going to go to the appointment scheduling link located under front desk. So we went over how you could manage appointments from the front desk screen under the manage appointments area, but most people like the appointment scheduling link because this is where you can see the individual resources columns. If you do any color coding for your scheduling templates, be able to see all that color coding for your practice. And you're allowed to book follow-up appointments, reschedule appointments, all from here. So obviously, depending on how many resources are in your practice and how you set up your schedule will probably look different than my training environment. But I set this up just to show you the different options. So here you can see I have 3 resources in my practice, in my view. And I've color-coded Dr. Harrington's and the EKG columns, but I left the exam room column at the default colors so you could see what it would look like if you didn't color code in ACPM. If you don't color code, it will automatically default the available color in this yellow and the unavailable color in this shaded yellow color. You can see it will always default to today's date. It'll show you how you set up your start and end time for your practice and what your increments are, whether you're 10, 15, 20-minute increments. You can change your increments over here on the right. There are some icons that not only allow you to change your increments if you want to, and you can see as I click on these icons, it's changing my time increments. But if you also wanted to expand your slot sizes on the schedule, you could select the expand and the collapse to make them larger and smaller. And then this last icon on the far right shows all of the different view templates that you set up in the administration. And we covered setting up the schedule in yesterday's session. So I have it so that I can view all of my resources at once, but I also have the ability to change my view and just look at one at a time. You'll also see that there's shortcuts to the administration area of ACPM and the schedule from here. And you also have the ability to view multiple days at once for your different resources. So by default, it's only going to show one day, but the drop-down arrow next to the individual resources headers, you'll notice you have the option to change your view to 5, 7, and even a month view for that resource. So if I change this to 5 days, I can now see Dina's 5-day view. And if I wanted to go back, there's arrows over here on the right that would then just change back my view to my default view. You'll also see a calendar over here on the right. Another way to navigate around your schedule, you can click on the different days of the calendar, or you can change the month or even the year of the calendar if you want to. There's also some links down here on the bottom left that will bring you to different areas of the calendar. Up here is where you can do a search and also use our advanced search option if you wanted to put in a certain criteria of appointment availability to have the system go out and search for you. So if a patient called and was booking an appointment and I wanted to default that patient up here, I could search for that patient up here. And then I could select the location that patient wants to be seen. I could select even a reason. Otherwise, I really just need to indicate the time slot size I'm looking for, so the duration. I could indicate the resource that that patient wants to see. And then I could also expand my search and even put in a date range. I could indicate number of weeks or months or years. I could indicate whether they would like AM or PM, and certain days of the week. There's even the ability to search for reoccurring appointments. And then once I fill out all of my criteria, I can hit the search over here on the right, and the system will then come back with bulk availability for me. And if I had the patient in front of me or even on the phone, I could go down this list, and as I click on the different days and times, it jumps to that day on the schedule and blocks out the times in blue so I can see when there's availability. And then once I find a day and time that works for the patient, I can just double click, and that's left click, on the time slot, and it will bring me to the book appointment screen. It'll pre-populate any fields that it can, and then I just have to fill in the remaining fields. And this appointment reason list pulls from your appointment type set up in administration. And again, I could easily get to my reason table by clicking on this and hitting manage table at the bottom. I could print a patient reminder sheet to give to the patient as they're leaving. I could link a referral authorization or account. I could also link a case if there had been one set up previously for the patient, and even add in a note for the patient's appointment. And then when I'm done, I can hit save on the bottom right, and the system will bring me back to the schedule for that day so I can see the patient's appointment is booked. And if I opted to print an appointment reminder form to give to the patient on their way out, it will pop it up on the screen for me automatically, and I could print this out and give it to the patient. Otherwise, if you don't like the bulk search, you can just use the book screen itself to find availability for your patients, and you can hide the advanced search option. So if you prefer to use the book screen, you may want to change your view to multiple days for that resource that you need to find the availability for. And then you can navigate with either the buttons down here or using your calendar until you find the day and time that works for the patient. And then you can click on the time slot and then proceed with booking that patient's appointment. You can also double book appointments in ACPM. So you can see here this slot is double booked. To double book an appointment, you can just go to the right of the existing patient's appointment, and you'll see there's a little space. If I click on that slot, I can then go ahead and book another appointment in there. The system will warn you, though, when you go to save that appointment, that you are going to be overlapping it with another slot. Same goes for if you book an appointment in a slot that is marked closed. The system will allow you to override it, but it's going to warn you when you try to save that patient's appointment that you're booking on a closed slot. Are you sure you want to continue? To reschedule appointments, it's pretty straightforward. You can either hold down your control key or your left mouse and drag and drop the appointment to another day or another resource that is already visible on the book appointment screen. And then once you drop it, it will bring up a modify appointment screen. It'll bring over all of the specifics of that patient's previous appointment, and all you have to do is hit save. Whenever you modify an appointment and save your changes, the system is going to ask you to indicate who is making the change. Are you doing this on behalf of the patient or the practice? And all this gets stored in that patient's appointment history in their chart. Otherwise, if you're rescheduling the patient's appointment somewhere other than the book screen that's viewable right now, you can right-click on the appointment and select Cut. Find the new appointment, and once you find the new availability, right-click and paste. And once again, it'll bring over all the information for you. If the patient has any recalls set up on their chart, when you go to save their appointment, you will get a recall for appointment box asking you if you want to link the unscheduled recall or recalls in the patient's chart to the appointment that you're booking. And if you did, you could check off next to the appointment and hit OK. Otherwise, you can leave it blank, hit OK, and it won't link the recall to the appointment. If you want to cancel an appointment, you can just left click and double click on the existing appointment and change the status of the appointment to canceled. You could put in a cancellation reason in the note box if you want, and then hit save. Once again, you'll have to indicate the change. And then it will actually take that appointment off the schedule. If you want to mark a patient's checked in, mark that a patient's been seen, or mark a patient missed their appointment, it's also double clicking and left clicking on the patient's appointment and changing the status to either checked in, seen, or missed. By default, the color for seen and missed appointments is gray. Otherwise, you could also change the colors and color code your appointment statuses. So you can see I color code my seen statuses to a red color. If you want to print an appointment list for the day, that's done under front desk as well. Miscellaneous daily appointment list. From here, you can put in the appointment dates that you want to run the list for and the location. Those are the only two requirements. And then you could indicate the individual provider or resource. Otherwise, if you leave it blank, it'll do it for all of them. And in addition to running your general appointment list for the day's appointments, you could also run an end-of-day appointment list for your cancellations, your reschedules, or even your missed appointments. You can just simply change the appointment status. You can then indicate how you want the information to sort on your list, what additional information you want to pull on the list, the line spacing, how you want the information to be sorted if there's multiple pages. You could also just run it for a specific start and end time. And then you can leave it at launch automatically. And if I hit save, it's going to automatically launch me my appointment list. So this appointment list will give you your filters, the time, the patient, date of birth, home phone, balance, length of appointment, reason for appointment, and that additional piece of information, which people usually want to see the appointment note if one was indicated. And then if you have multiple resources, it'll do it for each one if you indicated to run it by resource. And if you want to simply block and unblock the schedule from here, you can do that just by clicking on the start time that you want to block. And you'll notice once I left click on the start time, it puts a gray ring around it. And if I hold my left control down and drag it to the end time, it puts a complete gray ring around those slots. Once I do that, I can right click and choose to override this provider resources availability, and I can either make it available or unavailable. Whether you make it available or unavailable, you can even put in an optional note. And then hit enter, and it would put in that note. I could also do it for multiple resources at a time. So if I knew all resources were going to be out because it's either a holiday or there's a conference or anything, I could just drag and highlight all 3 columns, override, make unavailable, put in an optional note, hit enter, and it'll block all of them. And then same thing if a provider was taking a vacation, I could block out their whole week if I wanted to. So that's the best way to block and unblock availability right from the schedule. As the patient's checking in, you can easily access their chart from the schedule just by right-clicking on the patient's appointment and launching their chart, so that you can collect and enter their co-payments, update their demographics if necessary, and then when you're done, X out of their chart and you'll return right back to the book screen where you can mark that patient checked in. You'll also see on today's handout that if eligibility has been checked for that patient, you'll also be able to see their eligibility statuses right on the schedule, indicated with an icon on the top right corner of their appointment. And you could recheck their eligibility right from their appointment as well. I could right click and there would be a check eligibility or view eligibility link, and I'd be able to perform those tasks right from the schedule if I wanted to. You've also probably noticed as I've navigated that I get some demographic information as well at the bottom of the screen when I click on a patient. And this is convenient for confirming appointments, so you have the patient's telephone numbers and also seeing additional information for the patient right on the scheduler. So that's the front desk session of Amazing Charts PM.